While industries and South Africans await the President's address tonight, the question of the COVID-19 pandemic will be at the back of mind. To unpack this, as usual on a Sunday, we take a look at a breakdown of where the country is currently regarding the COVID-19 pandemic. Dr Ridhwaan Suliman, senior researcher at the CSIR. Thanks, as always, for joining us, Doc. Always a pleasure to have you on the show. Starting with the average daily COVID-19 cases per week in South Africa, that's now down 19%, if that's correct. Talk us through that.
Good evening, Griselda. Yes, so if we look at the number of cases reported nationally, it has stabilized, and we seem to be on a downward trend now for the past 2 weeks. We've averaged just over 12,000 new cases across the country per day over the past week, and that figure has decreased by 19% week on week. So if we look at that in terms of per capita basis, we're reporting 21 new cases per day per 100,000 people across the province, and that's down to 60% of what we were at the peak a couple of weeks ago.
If we look at the test positivity rate per week in the country currently, average at about 26.2%?
Yes, that's quite correct. So remember that the test positivity rate is very useful in quantifying any decrease in infections that we're seeing now in relation to the number of tests that we have been conducting. So tests have decreased by about 9% this past week, down to 46,000 tests per day on average across the country. But that rate of decrease in testing is slower than the rate of decrease in the number of positive tests or confirmed cases, which has decreased by about 20% over the past week. Therefore, the test positivity rate is showing a decline of about 11% over the past week, which is good. I think this decline in the test positivity rate confirming that the country has surpassed the peak of the third wave. It is still high at an average of 26.2%, as you mentioned, meaning that 1 in every 4 tests conducted is yielding a positive result. So we do need to remain vigilant and not become complacent at this stage.
There were provinces of concern, Gauteng being one of those that has reached its peak now. Daily COVID-19 cases per province. I mean, not much to celebrate, though. Still need to be very vigilant. But what are the provinces looking like?
Yeah, so certainly Gauteng is in a much better place right now compared to a few weeks ago. It has certainly passed the peak of its third wave, reporting just over 4,100 new cases on average over the past week, and that's a decline of 40% week on week. It's in Gauteng, the case incidence rate is now down to 35% of what it was at its peak 3 weeks ago. Similarly, the neighboring provinces of Gauteng are also showing promising signs, all having turned downwards. These include Northwest, Limpopo and Mpumalanga, which seem to have also passed the peak of their third wave. I think we do need to just watch the coastal provinces. They haven't all quite reached the peak just yet. Cases are slowing, or the number of new cases are slowing in Western Cape and Eastern Cape, but they are still on a slight increase. In Western Cape, new cases have increased by 6% week on week, and that province is on a bit of a stubborn plateau over the last week to two. Hopefully it will peak and start to decline over the coming week. Similarly, in Eastern Cape, new cases are declining, or rather the new cases are slowing but still increasing, up 4% week on week. The one that we aren't quite sure about what's going to happen is Kwazulu Natal, because of last week's decline in testing due to the riots and the protesting showed a rapid decline in the number of reported cases. It's now back up to where it was pre-unrest period, increasing by 50% week on week, but the number of tests last week was much lower. So we do need to watch Kwazulu Natal quite closely over the coming week.
And that would obviously affect, depending on what it looks like, the test positivity rate. If we look at per province, that will certainly be a telltale.
Yeah, indeed. Remember that the test positivity rate is very useful in quantifying the number of cases that we are reporting. And the test positivity rate across all of the provinces remains high. In Gauteng at least, and in the Northwest, we're starting to see a decline in the reported test positivity rates. But in Limpopo, Gauteng, Northwest, Mpumalanga, and even Western Cape, all of those test positivity rates still above 30%, which is still very high. In Free State and Northern Cape, it's still at about 20% or 25% rather, which also remains quite high. And the Eastern Cape and Kwazulu Natal at around 20%. So all of those are at high levels. And remember that we do need to bring these down to below 5% before we have this pandemic under control.
Healthcare workers will certainly welcome this. It seems like new COVID-19 hospital admissions per week in South Africa also down.
Yes, so this is some promising signs. Yeah. Nationally, we're seeing that the number of new hospital admissions last week have decreased by 7% compared to the week prior. And that's about 13,000 new hospital admissions across the country. So this is driven largely by the decrease that we're seeing in the populous province of Gauteng, which has seen a decline in new hospital admissions of 17% last week. Most of the provinces are showing a decline in hospital admissions. However, there are a few where there still is an increase. Western Cape saw new hospital admissions still increase last week. So too in the Eastern Cape, as well as a slight increase in Mpumalanga. Because of the lag factor, we do expect that those provinces will still see an increase until we start seeing the decline in the number of reported cases.
Unfortunately, deaths seem to be on the increase, average daily, an increase by 11% where we are.
Yeah, so remember that deaths do lag cases by about 3 to 4 weeks. So not surprisingly, we're still seeing an increase in the number of reported deaths nationally. On average, we've reported just over 400 new deaths per day across the country. That figure up 11% week on week. As we're starting to see a decline in the number of new hospital admissions nationally, hopefully we'll start to see this indicator start decreasing too in the next week to two.
Dr. Ridhwaan Suliman, always fantastic speaking to you. Thank you very much for always making time for us on the program to break down those statistics for us. Thanks indeed.